Hi, I'm Dr. Jerry Montagna with Health by Lights. Today we're going to talk about how to use the SuperPulse laser for general health. At least what I do and what we've heard of other people doing. We think it has more to do than what it's certified for. It's certified for muscle and joint pain, stiffness, arthritis, improved circulation to the area that's being treated. That's what it's certified for and approved for, but other people are using other things. You've heard of these things, so we're going to talk about some of that, and I'll show you what I do and why I do it. First thing you need to realize that the SuperPulse laser has 3 different nanometers. It has a 660 nanometer, a 875 nanometer, and a 905 nanometer, and all 3 of those lights are going at the same time. This little chart here will show you this is the device, this is the skin. You can see the 660 nanometer will go so deep, the 875 will go deeper, and then the 905 goes even deeper. But that 905, it's a laser, so a laser itself will burn, so they have to do something. So they do pulsing, and that's why this is called a SuperPulse. And what it'll do, it'll have different frequencies that it does the pulsing. Mode 1 on the device, it'll do a 50 hertz. That's how fast it'll pulse. Mode 2 is a 250 hertz. Mode 3, it'll pulse at a rate of 1000 hertz to 5000 hertz. And it'll scan back and forth. And if you put it by your ear, you'll hear it humming to you. You know, the fact that it's moving back and forth. So, Mode 1 will do healing. It's the primary thing and bring circulation to the area. If you push the mode button and go to mode 2, it's a 250 hertz. That'll be more for stiffness and healing or regeneration is what I like to use it for. And then mode 3 is what they call inhibiting. Anything you want to get rid of. I have pain. I want to get rid of it. I have stiffness in my joint and it's really stiff. You know, stiffness, a lot of times I'll use mode 2, but if it's really bad, then I'm going after the mode 3 for a while. So anything you want to get rid of. If I get a bug bite or sting or something, I'll use it on that because I want to stop that. So anything you want to inhibit or stop, that's where you use mode 3. So for general health, one of the things we do is treat the blood. When you want to treat the blood, and why they suggest treating the blood is the light therapy has an antioxidant or an anti-inflammatory character to it. So it'll be an antioxidant and treat the blood as it runs through. So therefore, that antioxidant and anti-inflammatory go throughout the body. 2 aspects. I've heard of, like, somebody has rheumatoid arthritis and it's bothering their elbow. You treat the elbow and then you treat the blood and it'll help get there, or whether it's the knee or whatever. Also treating the blood, we now know that heart attacks and these type of things, and strokes, a lot of it is caused by inflammation of the blood vessels. So again, anti-inflammatory components, so you treat the blood. The theory is, and there's some clinical research that is saying, so I'm not saying because it's not certified for that, but if you treat the blood, you can help just all the aspects that the blood will take it to. How do you do that? I use mode 1. Because again, general health and healing and circulation is what I use that for. And you push the start and stop button and it starts and it'll run for 5 minutes. Now what you have to realize, whenever you put it on the skin, and you always want to treat the skin, you don't go through clothes, the blood is going to absorb the biggest part of the energy coming from the light. So if I want to treat my elbow, I'm going to push down a little bit. So I will stop the circulation of the blood from going underneath, or slow it down at least, so more of it will go down through into the joint itself. So when I'm treating the blood, I don't want to put pressure. I want to just put it on there lightly. One of the places I treat is the carotid artery. You can just feel there and feel where you have the pulse. When you find the pulse, just gently put it over there and hold it. And I'll do about 5 minutes at that, and then I'll do the other side as well. So you just hold it there and you treat it. And just sit there and I watch ball games or movies or whatever as I'm doing it. Now, another place you can do it is the wrist, and you can even see the blood vessels there. They're very close, so just gently put it there and hold it. and you'll get the same type of effect. So those are the two main places that it's recommended to be able to use. Others will use it on the neck, different places, but I prefer the carotid artery and the wrist myself. Now, another thing that I will use it for is, if you look up acupuncture, there's a lot of acupuncture points on the ear, and you can use this to treat acupuncture. So I turn it on number 3, the scanning, which is what's usually recommended for acupuncture, and then I will treat the ear. Again, when you put it up there, I can hear it now with the scanning, you hear it humming to you. I'll hold it there for a minute and then I'll move it to another spot, but I'll just cover the entire ear is what I'll be out, particularly the outside, but the inside too. You can treat it that way. So I'll do the acupuncture points, or if you want to get in and study different acupuncture points for different organs, you could treat, if an acupuncture point, if you know one that goes to the kidneys, you want to treat the kidneys, you could do that. And that's, but that's a very broad acupuncture aspect, and so is this, but it will energize the area. Now, the other thing that I use it for, one, you can use it for the hair, but also just the brain itself. They're using a lot of these type of devices for concussions, some research on Alzheimer's, particularly out of University of Sydney in Australia, and seeing results with it. So I will use mode 2 because, again, that's regeneration. Again, mode 1 is general health and circulation. Mode 2 is healing and helping some with pain. Mode 3 is your pain and inhibiting. So I like mode 2, and I'll use it on my head. And you can hold it for a minute or so and then move it, or depends on how much time you have. You can hold it for 5 minutes and move to another spot for 5 minutes and around. You don't want to go through clothing, but going through hair is fine. It's not a problem. But just move it around the head. There's not any particular spot. I suppose if you had a certain area that was a problem, then you might want to go after that area. But other than that, but it'll dissipate fluids and just go in and help with regeneration. And yes, it can help with the hair some. I've used these devices for about 2 years before my hairdresser said, "Oh, you have more hair." Well, that means it went from about 3 hairs to about 10. So it didn't bring me a whole head of hair, but it did make a difference. That's how I use it for general health. If you have it, use it these ways. Particularly do this at night before you go to bed, and then you can do the acupuncture ones if you want. But I particularly like treating the blood is what I go after. I'm Dr. Jerry Montagna with Health by Lights. If you have any questions or comments, contact me through the website, and we'll try to get your questions answered. Thanks for listening.